Flynn.
Hey, Ricardo, it's good to be with you and good to be with the public health professionals as well. Thank you.
Hey, Mr. Chair, we are all live and recording, so whenever you're ready to start, we're all set.
Perfect, and I see everybody's here, so we're just gonna begin. I know that everybody has hard stops at 5, so we're not gonna go beyond 5 so that everybody can keep to their calendars, and looking at who's here, I don't think we should have any problem with that. So I'm gonna begin now. It's Monday, March 22nd, 2021. This is docket 0198 and 0199 regarding the reappointments to the Boston Public Health Commission Board of Health. For the record, my name is Ricardo Arroyo. I'm the District 5 City Councilor. I'm the chair of the Boston City Council Committee on Public Health. I'm joined by my colleague, Councilor Flynn. This public hearing is being recorded. It is being live streamed at boston.gov City Council TV and on the City Council's YouTube. It will also be rebroadcast on Xfinity Channel 8, RCN Channel 82, FiOS Channel 964. We will take public testimony at the end of this hearing. If you wish to testify via video conference, please email ccchealth@boston.gov to sign up. When you're called, please state your name and affiliation/residence and limit your comments to no more than 2 minutes to ensure that all comments can be heard. Currently, I don't believe we have any public testimony. You may also submit written testimony by emailing ccc.health@boston.gov. Today's hearing is on docket 0198, which is a message in order for the confirmation of the reappointment of John Fernandez as a member of the Boston Public Health Commission's Board of Health for a term expiring January 6, 2024. And docket number 0199, which is a message in order for the confirmation of the reappointment of Dr. Jennifer Childs-Roshak as a member of the Boston Public Health Commission Board of Health for a term expiring January 6, 2024. And so with that, I'm going to go ahead and kick it to the panelists for an opening statement. Can be as short or as long. I think it's just an introduction of who you are and your work on the Boston Public Health Commission board makes sense. Try to stay within 5 minutes. And we'll start with Mr. Fernandez, if you don't mind kicking it off.
Sure. Thank you, Chairperson Arroyo and members of the committee. I wanted to thank you for the opportunity to testify today. Again, my name is John Fernandez, and I am presently a member of the Boston Board of Health since 2018, and it's been a great pleasure to be on that group. I'll just give you some brief remarks about my background, just so they're on the record, and then we can proceed from there. I serve as the president of Mass Eye and Ear. It's a Harvard teaching hospital here in town, which I've led since 2007. And we're a specialty hospital, deals with the eye, ears, nose, throat, head, and neck. Throughout the pandemic, we've worked on ensuring that our patients are safe. And we provide fair and equitable care here, but also helping other hospitals like the MGH and others in our health system. We joined the Mass General Brigham Health System in 2018. We've also received a lot of awards here at Mass Eye and Ear, nationally recognized by U.S. News, and #1 in ENT and #4 in ophthalmology for many years. I also serve an additional role as the president of Mass General Brigham Integrated Care. This is a company we formed to focus on bringing the world-class care for all of Mass General Brigham closer to people's home at lower costs. Before taking my position at Mass Eye and Ear back a little while, I worked at the Brigham and Women's Hospital, and that led to me having a leadership role as vice president of surgical imaging and other services, as well as network development. I had the pleasure of graduating from the College of Worcester out in Ohio, and born and raised in Philadelphia. Not that Boston's not great, but I lived here for a long time, actually longer than I've lived in Philadelphia. And I hold a master's degree from the University of Pennsylvania. I also serve as the chairman of the Boston Conference of Boston Teaching Hospitals chair. And I'm a member of several different associations around the United States. And I serve on the board of trustees of Suffolk University. For the past 3 years, I've been impressed with the depth and breadth of the work at the Boston Public Health Commission, its partnership throughout the city. I've valued the opportunity to provide my strategic guidance and lend some of my expertise, probably very limited, but I've enjoyed sharing my experiences and working with both the public health commissioners as well as its staff. Over the past year, I've appreciated the opportunity as the council and commission have led us through the pandemic, which has been absolutely incredible in so many ways. I'm proud of the work that the commission has done over the related issues of health equity, from working to regulate tobacco products, drive inequities and premature mortality, and in particular, implementing the mayor's executive order declaring racism a public health crisis. As a leader of a healthcare organization, I understand how important it is to build upon your understandings of the root causes of health problems and then tailoring interventions at both a community level and a clinical level. Before I close, I want to acknowledge and appreciate the work and partnership with Chief Martinez, the mayor, and the many talented staff at the Health Commission, especially our interim executive director, Rita, and the interim director, Jerry Thomas. I mean, it's what a year for you to be in the roles that you were in. So I'm not quite sure how to say thank you more than thank you. And they've made great efforts to keep things rolling and deal with the multitude of issues that have faced the commission, the city, and especially the less fortunate people in the city of Boston. So I'd be glad to answer any questions that you might have.
Thank you, sir. If we can go to Jen Childs-Roshak. Sorry if I'm mispronouncing that last name. Names are important to me, so if I'm mispronouncing it, please let me know.
No, that's okay. Thank you. And good afternoon, Chairperson Arroyo, members of the committee. Thank you for the opportunity to testify this afternoon. My name is Dr. Jennifer Childs-Roshak, and I've served as a member of the Boston Health Board since 2018. I'll start just with a very brief overview of my background as well. I presently serve as President and CEO of Planned Parenthood League of Massachusetts and the Planned Parenthood Advocacy Fund of Massachusetts. And in this role, I lead the largest freestanding reproductive healthcare provider and educator in the Commonwealth. Every year, we provide services for over 30,000 patients across Massachusetts and provide nationally recognized education services for youth and parents through our education programs. So before joining PPLM in November of 2015, I served as the Boston Regional Medical Director for Atrius Health, while also seeing patients as a primary care doctor, and serving also as the site medical director for the Kenmore site. I received my medical degree from Temple University School of Medicine in Philadelphia. So Mr. Fernandez and I are Philly folks, at least for school for me. Completed my residency and internship at Maine Medical Center up in Portland, and I am board certified in family medicine. I also have an MBA from Boston University School of Management. I have a number of past leadership roles, which include medical quality and working in an FQHC and some of those other things, teaching and residency programs. And in addition, I serve as a member of the Massachusetts Medical Society's Physician Health Services Board of Directors and various councils that are really focused on providing strategic leadership and guidance around improving access to care and caring for the caregivers that care for patients. I have really appreciated being able to be part of the Board of Health, and I've really appreciated the opportunity to help provide strategic leadership and guidance to the Boston Public Health Commission staff. And I've worked in partnership with the Health Commission and the city staff to put forth annual budgets that have made some key investments and innovations to protect and preserve Boston's most vulnerable populations. I'm so proud of the policy work that we have done as a board to protect youth and communities of color. And Mr. Fernandez also referenced, I think, the amendments we put in place in 2019 to restrict the sale of flavored nicotine delivery products, and all the work that's gone on during the pandemic. I am also proud of the BPHC's work to implement Mayor Walsh's executive order declaring racism as a public health crisis. This declaration challenges us to build on years of work to address health inequities while sharpening our focus on understanding and addressing the role that racism plays in driving adverse health outcomes for our residents of color. And as a primary care doctor for over 20 years, I have seen this in action. And so I'm so proud of the work that Boston is doing to address this crisis. Before I want to close, I do want to also say how much I value the work and partnership of Chief Martinez, Mayor Walsh, and the many and dedicated, talented staff of the Health Commission and agencies across the city government. I think this robust response to COVID-19 has been really impressive. And I think Boston has truly led the way. And I too want to express my thanks to Rita Nieves and Jerry Thomas. Unbelievable to take the job and then to be hit with the biggest public health crisis in 100 years. So my hat's off to all of you. The last thing I would just say is I had the opportunity, the privilege to volunteer as a vaccinator at the Boston Public Health Commission's vaccine site when it was a health commission site at Reggie Lewis. And I have never seen such a well-oiled machine, such patient-centered care. And I have to say, I was honored to be able to vaccinate, but even more proud of the work that the Boston Public Health Commission does. So the team is really amazing. I know that the efforts we're making it really is saving lives and laying a foundation for just and equitable future for Boston. If my reappointment is confirmed, I look forward to being able to contribute and really help my fellow citizens here in Boston. Happy to take any questions, and thank you so much for having me.
Thank you so much, both of you, for your introductions. Really helpful, and I think good for folks who are watching. Now, Deputy Director Thomas, if you have anything you'd like to say, any introduction you'd like to give, mostly just to thank you for your service during a very pivotal, difficult time. And so thank you for what you've done. But if you have anything you'd like to add, any opening statement.
Well, I'm Chairperson, I am wondering, I did have a letter from Executive Director Rita Nieves that either we could submit or if it is appropriate to read into the record.
What's the length of the letter? Is it like a page?
It's about 3 minutes. I can submit it.
If you'd like to read it, you can read it. If you feel like it's important to be read into the record, you could do that. If you submit it to me, it's on the record as well. It's just wouldn't be.
Well, how about if I just go to the conclusion?
That's perfect. You can do
which is just on Rita's behalf, that in full support of both reappointments. She is stating, quote, particularly in my role as interim executive director, I've appreciated the service of both Dr. Childs-Roshak and Mr. Fernandez on the Board of Health. Their insight and depth of experience has been invaluable to the board and the commission staff, particularly as we seek to respond to and recover from enormous challenges presented by COVID-19 and structural racism. In short, I'm confident that the two appointees before you share our vision of a Boston where all residents can lead healthy lives, free from racism, poverty, and violence. And I fully support Mayor Walsh's reappointment to the Board of Health that are before the council. So I just wanted to make sure that her position was known to the committee.
Thank you so much for that. And we have Councilor Bach and Councilor Sabi George have joined us. I'm going to go in order of arrival, and I'll go last on this in terms of any questions that we may have or statements. Frankly, if there are no questions, Councilor Flynn, followed by Councilor Bach, followed by Councilor Sabi George, followed by myself. So Councilor Flynn, the floor is yours.
Thank you, Councilor Arroyo. It's good to be with you and our colleagues. It's good to see Jerry Thomas. Thank you for the work you're doing. I'm proud to work with you over the last several years. And to the commissioners, you're doing an outstanding job. Looking forward to supporting you as well. And just following up on your comments that public health, racism is a public health concern, which I certainly agree with. I just wanted to ask if we can continue to work closely over the upcoming year on issues impacting the Asian community, on public health issues. Highest asthma rate of any, Chinatown has the highest asthma rate of any neighborhood in Massachusetts. High diabetes rate, major environmental concerns, but I've had the opportunity to work closely with public health on this issue for several years, but want to continue working on it. Just wanted to get your thoughts on it. Appreciate you working with us on it, but it's an important issue, and just want to ask again if you can continue working with me on issues impacting the Asian community on public health.
Short answer, absolutely. I think it is really important, and it critically important that communities that are impacted by their environment, whatever the underlying cause, whether it's pollution or poverty or food insecurity, housing insecurity, all of those pieces play a role in every community. And I think, the events of last week certainly show that we need to pay a lot of attention to our Asian communities as well, for sure.
Thank you, Doctor.
Second the motion. I'd
Okay.
also like to I forgot to say this in my remarks, that I want to thank all of you and on the city council and public service for all you've done in the last year. It wouldn't have been as good as we had it without your support and help. And I'm also the son of a city councilor from Philadelphia. So city's a little bigger than your city, but it gave me instant respect with the former mayor, because when it was in Philly, he said it was the toughest town he'd ever been in. So it's a lot coming from Mayor Menino. But, thank you for your public service. I can imagine what it looks like.
Thank you, Mr. Fernandez, and just wanted to follow up. Appreciate your comments, and as part of that outreach, I know Councilor Arroyo talked about racism as a public health number one public health challenge, but also part of that, I think, is making sure that non-English speaking residents also have access to translators, and interpretation are also part of the public health outreach. I know you've certainly been working on that and have dedicated your life to that, but just want to thank you for that. And that's something that's very important to my constituents as well. But having said that, looking forward to supporting these outstanding commissioners. Thank you, Doctor, and thank you, Mr. Fernandez. Thank you, Jerry Thomas, and to my colleagues. Thank you, Councilor Arroyo.
Thank you, Councilor Flynn. Councilor Bach.
Thank you, Mr. Chair, and thank you so much to our nominees or re-nominees. I want to echo everyone's thanks for your service, both in your professional lives and the service that you do for the city. It's, I guess the one question I have, and it's really more by way of picking your brains than, I think I'm pretty excited about these nominations and expect to support them. But I just wonder, my perspective has been that this country has sort of criminally disinvested from its public health infrastructure over a long period of time, and that made meeting the challenge of a pandemic really difficult. I think folks in our neck of the woods really rallied and pulled resources from everywhere, but I think we can't pretend that we were optimally prepared or funded for this. And of course, but I hope that a silver lining of COVID could be that a lot of people who didn't understand the publicness of public health before, who didn't understand how all of our lives are bound up together, would come to understand that now, right? And so that there might be a real moment for a resurgence of funding and support for public health in the immediate years ahead. And, as they say, never waste a crisis, right? So I guess my question for you all is, as you think about, obviously we look at the immediate next 6 months and we're still talking about testing and vaccination and all of the things that everybody's been doing in the kind of emergency response category. But as we think about rebuilding and sort of having more robust public health structures, I wonder what you're kind of taking away from this year that we've been through, and sort of where you would hope. Obviously, as counselors, we're asked to review a public health budget every year. We're part of broader policy conversations, and I would love to know what you sort of hope the direction will be going forward in the public health space.
Jen, you want to go first, or?
Hey, go ahead if you'd like. I mean, I'm happy to jump in, but
I guess I give two quick responses. One is, I think the other thing the pandemic taught us was how much we can get done if we work together. Whether you're in a hospital, community service organization, an individual, the public sector, that we ought to take advantage of that crisis, and how do we continue to bring both the financial and human resources to working together, as opposed to sort of in competition with each other. So that'd be one piece of how we pool the resources, both human and financial. And then the second one is that how do we, especially when it comes to race, how do we do that more together? I know from just where I sit on the Conference of Boston Teaching Hospitals, there are multiple ways in which each institution gets asked to do X, Y, or Z. And then, so how can we set an agenda and then use the time, energy, and financial resources to attack, in some order, the things we want to attack first, as opposed to everyone's a one-off negotiation with each entity and each government agency and so forth. So to sort of pool those resources to get. I have a T-shirt that I really like that I made up for my staff, and it's really important that we focus on GSD, get stuff done. So I think that's where we could learn from this pandemic, because there's stuff we got done in weeks and days that have taken us, years under normal circumstances. So those would be my two take homes from what we've learned, and then what we have to do going forward. Because we definitely saw the public health infrastructure. We found some of its strengths, but we also found some of the weaknesses during this pandemic.
yeah, and I'll piggyback off of John. I think one of the ways, one of the reasons why things were able to happen, and probably not just in Boston, but that's a big part of my perspective, is because communities came together. And I think the thing that is sometimes missing from public health is the public, and the fact that community organizations on the ground level were able to mobilize quickly, feed their communities, protect their communities, make masks for their communities. Think about how vaccines were going to get disseminated. That is the strength of public health. And I think as an extension of that, and it goes to cultural competence and language ability and all of that, is really focusing in on an infrastructure that centers communities and prioritizes and resources communities. So I'm a huge fan of community health workers. And those are your friends and your neighbors, your aunties and your uncles who you can listen to and take good health advice from. And we have, I think, chronically under-resourced our communities and expected them to do the work for free. So I think a big part of what I hope we have learned is how to leverage those communities, how to resource those communities better. I mean, the other thing I would say, I don't want to be too controversial, but there is a public health structure in place. There's been a public health structure in place. I think the Boston Public Health Commission is a great example of a public health structure that does work closely with the community. But what has to happen is that people have to trust that. And I think, what we saw, part of the learning I take away from the pandemic is we have to trust that those systems are in place, and then resource them rather than reinventing the wheel, developing, new systems, paying for-profit organizations to do public health work. So I think it's really setting those things are set up. We need to leverage them and resource them appropriately. The other couple quick things that I would just say is and I guess I tend to be a little bit of a glass half full person, is people. I think the pandemic has really helped people understand not only that that racism is a public health crisis and a public health emergency. But people are starting to understand health inequities. And they, the differences between Black and brown populations and white populations has been in stark contrast here during the pandemic. And I think, when I talk about health equity, people don't scratch their head as much. And so I think that's a really important thing that we need to continue and not just have it be part of the pandemic, because it's not just part of the pandemic. The pandemic unroofed that, and so and laid it bare. So I think that's another important next step and takeaway that I think is going to be really important to the public health infrastructure. So resource those things, I think, prioritize those things, hold us accountable to those things, and invite the community in to really participate in some of those solutions.
Great, thank you both so much, and I strongly agree with your delicately put controversial point. I think that we have to invest in. It's just so often, actually, when it comes to like pulling a bunch of the pieces together and getting stuff done, this public side is scrappy, but it's motivated by the public good motive instead of the profit motive, and so actually it's better suited to deal with something that isn't driven by like a profit opportunity. And I think I've been proud of our infrastructure through this, but there's definitely been opportunities where we could have empowered it more. And I really take Mr. Fernandez's point. I mean, I think we've seen so much, and I'm of course the counselor with most of the teaching hospitals in my district. And I think we really saw in the pandemic how that degree of like medical expertise and renown and all actually partnering with this public health structure, right? And the city led apparatus could really be more than the sum of its parts for really serving the residents of Boston. And it strikes me that, that's that kind of partnership for like, how are we going to solve COVID? Oh, we're even, we're going to do all kinds of collaboration that we've never done before. We're going to share our bed counts. We're going to, ship supplies around and whatever. I mean, that's the kind of headspace we need for tackling racism as a public health crisis, for tackling I think a lot about housing insecurity in the city as a crisis. So yeah, definitely hoping we can learn those lessons, and glad to have you guys looking to continue your service with that wisdom gained from this experience. So thank you so much, Mr. Chair.
Thank you, Councilor Bach. And now it's my turn. And so I'm going to echo the thanks that you've been given already, but I do have some things, one of my major, I'm the chair of public health. This is an issue that I care about deeply. One of the first, it actually was the first thing I did. My maiden speech in March was racism as a public health crisis. And I wouldn't have been able to do that without the data and the studies and all of the information that had been provided by the Boston Public Health Commission already at that time. And so what allowed for that to move forward was the research and the work that you'd already done at the Boston Public Health Commission. And so for me, as I speak about these issues, racism as a public health crisis is big. The reason I was able to move on that, the reason why I identified that as a problem so early, was that I believe on the Boston Public Health Commission's own data, what they found was every single social determinant of health, which is 20 plus things, racism impacted each of those things negatively. Beyond just the impact of something racist happening to you impacting your health negatively. And then within that, that's 26 different things that we have to touch and try to deal with. But for both of you, since you're here and you both have specific things that you can focus on, one of the things that also informed that was a Globe story, the title of which is escaping me, but it was part of their large sort of ongoing series on race in Commonwealth. And race in Boston. And one of those series was on health. And specifically, the total number of people of color going to what hospital and receiving care at which hospitals, and sort of the segregation that we're experiencing within where people seek care and how they experience them. And that kind of dovetails into my question, which is, what are we doing here? And Mr. Fernandez, this might be more relevant for you as somebody who's at Mass Eye and Ear, but what are we doing to address sort of systemic racism as it exists within our hospital institutions? And the reason I say that is this, and this is more of a Jen Childs-Roshak question. Black maternal health is a big deal for me. And what we're seeing is, I think at last look, it's about 2.5 more mortality for a Black woman than a white woman. And the data, and the reason why this is important for people who are watching, it's not that these are folks coming from lower socioeconomic spectrums. This isn't a situation of people with lower levels of education. This is folks on an equal basis. A college-educated white woman, a college-educated Black woman from the same socioeconomic background are having severely different experiences and more fatal ones. And when we looked at health in general, what we were seeing were the reason why it isn't just a socioeconomic issue, the reason why it isn't just a class issue, is that when you took people from the same economic background, when you took people from the same educational background, they still had different sort of outliers in what their what their health experiences were. And so the two questions that I have here are, one for Mr. Fernandez is, how do you see us being able to leverage the Boston Public Health Commission and sort of addressing the systemic racism that is at play within our hospitals in terms of how patients are receiving care, how patients are treated when they're there, and how we're enforcing, or more so empowering, the Black, Indigenous, people of color who work in these institutions to make these places more culturally appropriate, culturally competent spaces. And then as well for Jen Childs-Roshak, in terms of the Black maternal health issue, what are we doing to lift those up at the Boston Public Health Commission in like meaty, solid ways? Because I think when we talk about racism as a public health crisis, that's so many things, and you can get lost in that. And so, you know, in the interest of getting stuff done, what specifically on those two fronts can you both speak to?
So I give you a quick outline on the hospital question. I think there's probably 3 or 4 levels. So the first is, I would say, from a leadership from a Boston Public Health Commission, but also from a city council public sector point of view, is you should hold us accountable for making the changes that we've said that we would do. Now that sounds a little trite, but I think it's here are those list of things. First is from a governance and management point of view, we have to make our governing bodies and our leadership structures look more like the people that we serve. And that takes time, but is the effort being put in. Second is for the people that work there, how do we make more opportunities available for the people of color, and how do we do a better job at that? And that's a measurable thing. And that's both people that work in the institutions, but also the vendors and providers, because healthcare generates a lot of other work that we actually contract out. So those are 2 things. And then third, I think very importantly, are what specifically are we doing in especially minority neighborhoods, but also I would add to it low income neighborhoods. Not that those are all minority, but it's in all of our interest to keep people who have less financial resources healthy. What did we see during the pandemic? We saw lower income neighborhoods, no matter what their race, suffering way more than middle or upper income. So I think there is an economic component that we need to make sure that we're on that. And what are we doing for diabetes? What are we doing for the diseases? Not just the jobs and so forth, but what we as hospitals, what can we do from a clinical point of view to increase access in closer to people's homes? So at community health centers, neighborhood, where do we build things? Where do we make things? And those would be the things that I think you can, and my last point would be what I said earlier about bringing the resources together. What can all of the hospitals or health organizations do together to meet a priority list that we set together, as opposed to, you know, one hospital focuses on one thing, the other one focuses on another. How can we sort of combine the resources to tackle, because these are very, very complicated problems. And if you have, I think you just said it, if you have an agenda that's 15 things long, you might get none of the 15 things done well. If you had one with 3 and we all those, that were very practical and impacted people on a day-to-day basis, I think we'd be in a better spot.
I agree with that. And I think that's one of the reasons why when we talk about racism as a public health crisis, I want the city to narrow in on where and how they're dealing with that. So I'm handling that from the city side. But since I have folks here who are part of institutions, either nonprofit organizations that carry, you know, a big stake and a big voice and podium, and actual hospitals that do as well, sort of what part of that you're narrowing in on. So thank you, Mr. Fernandez, for that. And for Mrs. Childs-Roshak.
Yeah, thanks. And thank you very much, Councilor Arroyo, for raising up and really specifying. I think people tend to go to for Black mom maternity morbidity and mortality stats immediately go to, oh, but they're different. Like, no, this is it's a huge issue. I don't need to tell you all that. And I think, you know, what we're doing at our organization, but what I see happening at the Boston Public Health Commission as well is I think, you know, trying to tackle racism in healthcare and the impact on real people like Black moms. And that's just, you know, one example, is thinking about, you know, the individual work that needs to be done, the organizational work that needs to be done, and the structural work that needs to be done. When you peel back those onions, you realize the level of implicit bias and explicit bias that happens every day. And I think, you know, one of the things, and I've, you know, unfortunately seen this in action. I remember my OBGYN rotation in Philadelphia at Temple Hospital, working with Black moms who were delivering as a medical student, and seeing, you know, the stark differences in care. I don't think things are any different now, 30 years later. I think, you know, that is a focus at the Health Commission. You know, Jerry can list all the programs, but I think, you know, everything from, you know, nutrition to early access to prenatal care. But I think as a primary care physician, I think the thing that I do think we need to continue to work on a couple of things that we don't talk about that much. You know, one is trust. You know, the patient, doctor, patient provider, patient midwife, patient doula relationships are really critically important. I think also advocacy for patient-centered care, right? So there are some really good programs that center the pregnant person and their family in care, and I think that those are really important ways to think about healthcare for populations that aren't being listened to and may not have the same level of access to care. And again, it's not often, I think, you know, being, you know, having the access, it's having access, but then not being listened to. So I think, you know, having community-based programs, I think advocating for things like out of hospital birthing centers, things like doula support, extending, you know, the recent ACA extension through the Rescue Act, that extends postpartum care for up to 12 months. It's things like that will make a difference. So I think it's a combination of advocating for real action, and also within all of our institutions, thinking about what is the individual work we all need to do to become anti-racist, what's the organizational work that we need to do, and then the systemic work. I think the last thing I would just say, and this is probably not something I have a lot of control over, but certainly would be very happy to participate in, is making sure that providers who are in the system, whether it's nursing, medical, midwifery, medical assistants, but our providers, we have a workforce that really reflects the patients and the members of our community. And I think there's still some work to be done around that. And I know that the Boston Public Health Commission has put a lot of effort so far into building the workforce, but I think even in the provider space, there's a lot of work to be done still.
So thank you both for your very thoughtful answers to a complicated question and for your work this year. We've been joined by Councilor Mejia. And so I want to make sure she also has 5 minutes if she has any questions or any statements she wants to make on the reappointment process, and then I'll cut everybody loose. So Councilor Mejia, the floor is yours.
Hi, Good afternoon. Sorry for my tardiness. Thank you, Chair, for hosting this, and to the nominees for being here. We know that when it comes to all things pandemic, this conversation in terms of public health is crucial. I'm hoping to hear a little bit more about kind of what you have learned in your term. That you, from your previous term as a member of the Board of Health, and how would you like to take what you've learned into your second term? And I'd love for you to answer that, really looking at it from a racial justice lens, specifically in the time of COVID. So would love to hear kind of what your thoughts are moving there. And Councillor Arroyo did declare public health, racism a public health crisis, and having worked in the public health space 150 years ago, I'm just so incredibly grateful for his leadership and really calling it out, because my hope is that by doing so, it will apply that type of pressure that we need to not just call it and declare it, but really put some systems and resources behind it so that we can once and for all eradicate it. So with that, I'm also curious to, similar to Councillor Arroyo's question, how do you see the Board of Health using its voice to offer support for hospital workers, many of whom experience systemic racism and harassment in the workplace? Would love to drill in a little bit more on that. And then I have one more follow-up question. So I don't want to overwhelm you with too much, but if we can do those two questions and then one more after that.
And I apologize. Would you mind repeating the second question? My internet was a little unstable there for a second.
And also,
sorry.
And I just talked. No, don't apologize. I talk too much. Of course, that's going to happen. You probably forgot what I said earlier. So I'm curious, similar to Councilor Arroyo's question, how do you see the Board of Health using its voice to offer support for hospital workers, many of whom experience systemic racism and harassment in the workplace? So you want me to translate that in Spanish too, John?
I'm glad.
No, I was hoping that John would jump in with the hospital question, but I'm happy to answer the first one if it gives you a little time, John.
Go right ahead. I'm good either way.
Yeah, all right. So I think, I think there's so many lessons learned from this pandemic. And I think, I'm not sure if you were on when I said it before, and I don't want to repeat myself too much, but I feel so strongly about the community-based approach and the resourcing communities to be able to do the work that they know that they need to support their communities, and not to say, here, go do it yourselves, but to say, what is it that you need? How can we help? What's the data that you need? What are the resources you need? What expertise do you bring to the table? What expertise can we bring to the table to really, really make sure that no community in Boston is left behind, for whatever reason they may be. So to me, that's a big, I think a big takeaway. And then, I think I'll let John talk about the hospital-based workers, but what I would just say a little bit towards that, since we have, I think, our frontline staff, not quite the same as the hospital, but I think that the behavioral health impact of the pandemic cannot be underestimated. I think on the frontline folks, and not just healthcare workers, but folks who are in the grocery stores, all of that. I think that we need to make sure that we have enough systemic care, I think, for behavioral health. I think there's a whole bunch of folks who are experiencing and will be experiencing post-traumatic stress related to everything that's happened with the pandemic, from illness to inability to get care, to housing loss, to job loss. I mean, all of that just multi-layered. So I know that we are already under-resourced when it comes to behavioral health services. We see a spike in substance use disorder connected and not specific to healthcare workers, but just in I think across the city in general and across the country. So I think, being really prepared to handle this post-pandemic care for the people who have been caring for all of us, I think is going to be really important. And I do know that that's something that the Health Commission has always prioritized, but I think when we think about budgets and priorities and resources, I'd like to see the City Council really recognize that post-pandemic stress, and there's going to be a lot of fallout from that, and we should be prepared to support people, no matter where they work, but especially the frontline workers.
Thank you for that, Jen.
So thanks for the question.
Okay,
I guess
John, you gotta she gave you a lot of time.
yeah.
Yeah.
And then I have to be better.
Yeah.
We're equal. First thing I'd say is that the behavioral health thing is a huge. I think we have seen the tip of the iceberg from what this pandemic has done to not only healthcare workers, but the stress on home life. It's just, I'm very worried that that's something that we are like, oh yeah, we'll get more counseling. We see it in the hospitals and big time with our staff. But let me answer your question about how can we focus on this matter that you bring up on both the staff at the hospitals, but also race and the intersection with healthcare. I think the biggest thing we can do, where a city council or Boston Public Health Commission can do, is what I said earlier, which was, let's try to set the priorities and not make them so broad that they capture everything. What are the specific things that we as hospitals have committed to do, or maybe haven't committed yet? But what are the top 2, 3, 4 things so we can all focus on getting them done and then move on to numbers 4, 5, and 6. So, for example, we've committed in at least in the Mass General Brigham system, training for staff, how we hire, and what are the results of how we hire, getting more diverse staff in our organizations. Those are all things that we could work together. And what are those? What are those key items? Whoops, I think we lost the city councilor. I'll stop answering her question so that.
I'm so sorry.
No worry, you're back. I don't know where I lost you.
Oh, well, I'm just gonna let you know, Mr. Fernandez, that I'm gonna have to go look through the tape because I know that you probably gave the most compelling testimony to my question. And I was not here for any of it, but I will promise you that I will listen to the tape. I don't want to occupy any more space. Councilor Arroyo, do I have time for one more question?
You do. They have a 5 o'clock card stop. We're at 4:49, so we're doing good.
Okay, let me leave here. So that you don't see two people. Sorry about that. So I'm just curious, Jen, you had talked about the whole trauma piece, which is definitely something that my office has been really pounding the pavement around the recovery. And we have seen that a lot of, in terms of the workforce, we're looking at Boston Public Schools, we're looking at a lot of our city agencies. We've had this whole mentality that we're just going to do business as usual and just kind of transition back into work. And so I'm curious, in terms of when you start thinking about this work, how do you see the role of the Boston Public Health Commission and your work and your appointment really being a leader in supporting and fighting for those dollars? Because I know a lot of it is going to come down to how much money. But I also think that there's an opportunity to engage other stakeholders. I think about barbershops and hair salon owners. I think about bodegas. I think about these non-traditional places and spaces where a lot of conversations are being had around mental health, but they're informal spaces. So I'm just curious about what you all are thinking in terms of strategy for engaging these non-traditional groups in conversations of mental health. And when you think about the budget season, which is down around the corner, what are we looking at in terms of securing additional funding for mental health and wellness support?
Yeah, so that's a great question. I wish I had the answer to exactly what the budget line item was, but I think, you know, you are so right about those, you know, I hesitate to say non-traditional because it is traditional, right? I mean, those are the places people have those conversations, and we, I think, need to resource them, and then also, you know, have people know, like, well, what information they can. So if someone's talking to you in the hair salon, to be able to say, oh, well, not just you know, listening to you and I'm going to give you some support, but here's actually some, you know, here's a phone number you could call. I mean, I think it's creating those resources for those community contacts to then be able to move people along. But in terms of your very concrete question about money, you know, I think I would defer that to Rita and Jerry as to where it is in the budget. But I do think it has to be prioritized. I also think that, and this was something that came up in the mayoral transition group around public health that I was honored to be part of. You know, there's money coming from other sources too. And I think there's some real opportunity to focus in on where are those grants, where are those resources, federal, you know, state. You know, it's almost like a full-time job, I think, to sort of track down that money so that it's not just sort of business as usual with the city budget. It feels to me like there are some opportunities, you know, through various federal programs, the Rescue Act for one, the CARES Act, the PPP loan, things like that potentially could augment what's already in the budget. So I think that would be some time well spent.
John, ¿tú hablas español?
What'd you say? Sorry.
Que si tú hablas español.
Oh, see, here's where you got me. My great-great-grandfather was from Spain, and I speak no Spanish.
Okay. Well, you're carrying that name.
I mean, I could say hola and things like that, but my high school Spanish is leaving me.
Okay, well, I just want to make a note that when it comes to language access and interpretation and translation, as a Board of Health, I'm really looking to you all to making sure that we're able to communicate with people in languages that they can understand and that it's culturally competent. And John, the next time you come through, you better learn a few words, okay? Because I'm going to call you out again.
Gracias.
Thank you, Councilor Arroyo.
Thank you, Councilor Mejia. Thank you both of you. And I'll be moving for you both to be reappointed at our next council meeting. So thank you both for being here. I appreciate you taking the time. I'm going to let everybody go. Thank you, Ms. Thomas, for being here as well. And so much appreciated. And with that, this meeting is adjourned. Thank you, everybody.
Thanks so much. Take care, everybody.
I know.